Welcome to the Fusionary Health podcast. I have a special guest for you today, Dr. Anthony Dardano from Boca Raton, Florida. Welcome, Dr. D.
Hi, how are you? Thank you for having me.
Of course. So, everyone, I want to share a little bit about Dr. D before I jump in. He's a board certified plastic and reconstructive surgeon right here in Boca Raton. He earned his medical degree from Nova Southeastern University and completed his general surgery residency at Wayne State University in Detroit and his plastic surgery residency at the University of Texas Medical Branch in Galveston. I'm from Houston, Texas, so near me. He's also completed a cosmetic surgery fellowship in Miami with Dr. Jim Stutson and Tom Baker, and he's double board certified by the American Board of Surgery and the American Board of Plastic Surgery. And you have a whole long bio written after that as well. But basically, he's written textbook chapters. He's internationally spoken on many conferences. He also serves as a professor of plastic surgery at FAU School right here in Boca at the School of Medicine, and he's the site director for the residency program. And recently, Dr. Dardano was hosting an international conference on plastic surgery where he invited me to speak, which was so cool. And he's part of the International College of Surgeons, where I also just spoke. So, Dr. D, it sounds like you're quite busy.
Yes, I'm very busy.
Like so many doctors, and I wanted to share before I ask you all my cool questions today. I wanted to tell my audience why I have you on. So this is the Fusionary Health podcast, and my goal is always to show you all the best of the best doctors who I have found and show you that there's always these varying viewpoints and perspectives. Even orthopedic surgery can be holistic. Even plastic surgery can be done with a lot of consciousness and awareness of why you're doing it and what is the goal here? What are we trying to get to? And so my story with plastic surgery is I had kids. I've been open about that. I have these two beautiful children. And I knew pre-children that one day I might need a breast reduction because I was just really big going into college. Like that's just where I tend to gain weight. And I was thinking about this episode, like, am I going to talk about my chest size? The thing is, half the population on this planet is women. We all have these same body parts. And in my case, I knew that what I had was causing me neck pain. And once I had my kids, within a year of having my first child, I was starting to interview plastic surgeons and asking, hey, what can I do here? This hurts. My neck hurts chronically. By the time I had my second kid, I realized I was living this lifestyle where I was laying on the couch most of my evenings. I had gone to chiropractors and spent thousands and thousands of dollars. I was doing anything I could on earth to reduce neck pain, and nothing was working. I had gone to spine surgeons. I was trying to understand, like, what do you do for this? And finally, when I started seriously interviewing post 2020 for plastic surgery, I met Dr. Dardano and realized he was the one. He was the one who I would trust to cut open my body, because in Ayurveda, we teach that the worst thing you can do to your body is cut it. Like, make very conscious decisions around surgery. And so I'm pretty much the most anti-surgery person you've ever met on earth. So when I make the decision to do something to my body that's that serious, I have a lot of consciousness and awareness. And I'm very much energetically trying to see, is this someone I can trust? Is this someone who has the right experience, who's going to understand what I need? And so, Dr. D, when I met you, I thought, wow, this is a big undertaking, but I knew that it would help me. And in the end, it did. I had breast reconstruction or breast reduction surgery, and all my neck pain went away. And I haven't had to go to chiropractic, medical massage, all the things I had to before. Every time I worked out, I was pulling muscles in my back and ending up in so much pain that's gone. And so, will you share with our audience today, when it comes to plastic surgery and when it comes to your clients, I know that when you do surgery, you also are in the ER at times, saving patients and doing so much other work. It's not just plastic surgery that you do. So will you share your perspective on it and why it can be such a powerful tool that people use to getting their body back to the way that they want?
Oh, that's actually a great introduction, and it's nice to hear you share your experience with it. Most women either keep plastic surgery quiet, or like you, they want to teach and educate other women. You know, when you come to see me as a consult, I always tell women, nature is not fair. Genes are not fair. You're sometimes dealt a particular issue where others are not. For example, you were born with large breasts. It's not always a blessing. It could be a problem.
Right.
And it putting on a plastic surgery hat and becoming a plastic surgeon as opposed to being a general surgeon where I trained in trauma and took care of people who actually needed surgery as a life or death situation, it's a little different from a plastic surgery perspective, right? You're coming to me and you're asking me to perform an operation on you, which you don't need, it's something you want. So it's purely elective. And I think every surgeon should consider it an honor and a privilege to be able to operate on somebody, right? Somebody puts their trust in you to do a procedure. And it's my job to deliver the most safe, control, and hopefully pleasant experience because, we're human beings. Surgery is a difficult challenge to have. So when somebody comes to me with large breasts and they want them reduced, I want to know a little bit about them. It's
Right.
not just you come to me, can you do this? Where are you coming from? What are your activities? Where are you in life? What have you done? Done breast reductions on 17 years olds, and I've done them on 75-year-olds.
Wow.
And the range is for many different reasons. Young girl might be in sports. I just recently took care of somebody who is a volleyball player. I mean, a class one college volleyball player. And it was very difficult for her to work out and perform her sport with large breasts.
Absolutely.
And she managed to do it for a long period of time, but just got to the point where she wanted to move on to the next level. And it was hard for her to train. Where I have an old lady who comes to me at 75. I go, why do you want your breasts reduced? And it's a funny story. She goes, listen, I'm an Italian lady. I'm 4 feet tall. Every Sunday when I cook on my stove and I want to stir my pots of sauce, I burn my arms or I burn my breasts because they hit the oven. And I said, okay, that's different reason, but I accept it. So people do things for different reasons, and you have to digest that.
Absolutely. And it's interesting because so many people come to me and they delay surgeries, whether it's knee surgery or different things. And it's really being in health and wellness, my perspective has changed. I would say 10, 20 years ago, I was like, surgery's bad, never do it. Now my perspective is quality of life matters. Your mobility and functionality matters. You should actually do whatever it takes to have that early on so that you get to live your life more mobile and functional and happy. And so for me, when I was doing HIIT training and jumping on boxes and all this stuff, a lot of times it was in my way. And I was like, I just want to be normal. I don't want to have to contend with this issue. And so I know so many women do breast reductions, breast lifts, breast augmentation. And in the health and wellness world, I read a lot about women getting explant surgery and how explant surgery and getting rid of their, what do you call it? Breast augmentation, helps them be healthier and clear up any kind of autoimmune or health issues they were having. So will you speak to that? Because I always love learning, like, what are the different perspectives on it?
Sure. So our Aesthetic Society, which is our plastic surgery society, which monitors all these numbers and carefully records and has very good data on all the aesthetic surgery that we do, just came out with a bunch of numbers. Like in 2022, there are about 365,000 cosmetic breast surgeries done in the United States, which, right, that's enough, but it was up 44%. So the rates of surgery to put implants in were up. At the same time, there was about 150,000 procedures in which women had implant exchanges. That means they had implants in and they changed them out for either smaller, larger, or the old ones for the new ones. So between the two there, it's about 500,000 cases a year where implants are being put in. That was up about 30%.
Oh.
The number that's interesting is there are about 71,000 women who had their implants removed and they did not have them replaced. So that seems like a low number when you're talking about how many people we have in the United States, but that number was up 50%. So 2 years ago, we had 50% more women deciding they just wanted their implants out. Now, Could it be for personal reasons? Yes. Could it be they had some kind of breast implant illness syndrome? It could be. I've seen people coming in with questions like, do I need to remove them?
Sure.
And my answer is, how do you feel? What's making you feel this way? Do you have physical symptoms or do you have psychological symptoms that may be affecting you? It's where I have to put on kind of my psychology hat.
Sure.
We don't want to do an unnecessary surgery to remove implants if it's really not going to benefit you when you weigh that scale of risk and reward. Okay. But I have done a lot of explants on women, and the follow up with them is that they're happier. They tend to do a little bit more activity. They said my implants served me at the time when I needed them.
Sure.
And now that they're out, I don't regret it. And I'm very happy.
Wow.
So I guess the interview and the discussion with a plastic surgeon that really understands where you're coming from and not trying to sell you on removing them. Because when this whole breast implant illness thing came out several years ago, it's funny that the surgeons who were the number one breast augmentation surgeons all of a sudden became the number one breast removal surgeons, and they're experts in it. So was it a monetary reason? I mean, why were you promoting it one day and the next day you're taking it out? So the problem with information is that there's a lot of it out there and it's accessible to everybody. If you go to a well-trained surgeon who deals with it, they can kind of decipher the information and get to the real reason why something should be done.
Right. No, absolutely. And I have a follow-up question on that.
Sure.
Dr. D, I feel like your background, the way you have it, is causing you to have no hair.
No hair. I'm going to get rid of my background.
Yeah, I think you should change your background to not being the
I noticed that.
Yeah.
None. How about no background?
Yeah, I think it's better.
Ta-da.
Yeah.
I did. I looked at it. It looked like I was bald.
Exactly. I was like, you're not going to like this video afterwards.
I have a beautiful head of hair. I don't want to
Exactly. It should show.
Thank you.
You're welcome. I was like, I got to pause this and let us do that. So I'll tell them to edit that.
Good.
So based on what you just shared, yes, there's implant and there's explant. And so many of us make a lot of decisions around our health based on what serves us in that time period. I totally get that, because some of us hit each decade of our life and make big shifts in terms of what we want. I'm one of those people. I'm like in the mood of more biohacking and detoxing in my 40s than I ever was before. But I wonder if part of why people are into explant surgery is how their surgery was performed. So when I met you, I had also met surgeons who were like, right out back, we have where we do the surgery and we'll just go ahead and do. And I thought to myself, I was like, I kind of want to be in a hospital. I kind of want to be in a safe space in case anything goes south. You should have every single tool on earth to save me, again, because surgery is such a huge trauma to the body. So will you share your perspective on that? Because it was one of the big reasons I came to you.
Sure. Like I said, it's an honor and a privilege to be able to operate on somebody as a surgeon. And there should be no greater trust between anyone than between a patient and their surgeon, right? You wholeheartedly trust that. So it's my responsibility to not only perform the operation, but to make sure as a whole you're taken care of. And I think I get a lot of that background from being trained as like a trauma surgeon in the past. I know life and death. I know what can happen to you. And just because you're having a cosmetic procedure doesn't mean it's any less of an operation, right? You're still going to get an anesthetic. You could still have an issue, problem, or complication from that. Your body responds differently to different medications that are given to you. So for the past 25 years, I have done all my cosmetic surgery in a hospital. Now, hospitals have outpatient areas and they have inpatient areas. So people might get afraid, oh, I don't want to go to the hospital. That's a big thing. I think there's no safer place to be, because once you're there, I have everything at my resource for you should you need it. All I have to do is either walk out the door and ask. And it's comforting because I operate on a lot of moms. I mean, when I do the mommy makeovers, I want to make sure the mom is taken care of, right?
Right.
It's not that there's anything wrong with outpatient surgery centers. They're all monitored and regulated, and they have to really live by strict standards, but you still have to like call an ambulance to come pick you up and take you to a hospital.
Right.
And that little bit of time frame could be agitating for some people.
Right.
Again, I'm not saying there's anything wrong with it. I'm just saying I feel more comfortable, and people do come to me after seeing other docs because I do things at a hospital.
Sure. Sure. And so when it comes to these ideas, you know, one thing I get the luxury of is because I hang out with you at conferences, we get time for coffee, and we just had this profound conversation at International College of Surgeons. And really, it's a big mission on this podcast to show people that I am so integrative and so Eastern and so functional medicine pro. And I'm also pro every single resource we need, because with surgery, a lot of times you're making these huge decisions and people are so scared of surgery, myself included. But when we come to that door and that decision, that, okay, I'm going to choose to go, let's say it's knee surgery, let's say it's hip surgery, back surgery. People get all sorts of surgeries, or in this case, plastic surgery. You could show up healthier and prepared. And so when you and I had that discussion, I said, look, I had children, love the kids, but as someone who's been obsessed with fitness and health my whole life, I don't think it's fair that now my breasts are hanging down near my belly button. I want all this reduced. I want this lifted. I want to be reset to factory settings, is how I think of it. That I had original factory settings. I just want to be reset back to what I had. And then my job is to maintain it. And I think we both know that post-plastic surgery, you could lose all your results. All you have to do is go back to eating and living the way you were. And it's your job to maintain your results. But one thing I really love about you is how obsessed you are with nutrition, glutathione, and people taking conscious action to show up healthy for their own outcome and results. So will you speak about nutrition? I know you're recommending nutrition to your patients so that they show up and get a healthier outcome. So they come in healthy. And I know one big compliment you gave me was, wow, I've never operated on such healthy tissues. And I thought, okay, I did 6 months of work to show up to you my healthiest, as if I was walking into a marathon, so that I knew that post, my recovery should be a cakewalk and I can go back to lifting in my normal life.
And your recovery was easy because you came in prepared. You know, I tell everybody, I try to relate surgery to something you do in your life. A lot of women are very athletic and some are runners. I said, listen, if you're going to say our surgery date is, May 15th, May 15th is early, but we're going to run a marathon on May 15th. Your body is going to undergo a marathon. It's going to be stressful for you and you have to prepare for it. If I told you you were running a marathon, you'd say, oh no, I need time to prepare. I'm going to run the one in November. Then that's what we're going to do for surgery. We're going to get you prepared. Right. Because just living your life, eating the diet that you do, it may be, you might think you're healthy, but you're not. But when your body's put under a stress, now there's extra requirements that your body needs to heal. And again, I learned from my trauma background that when a patient is severely injured, whether when they're 18 years old or healthy, their body requires more calories, more energy, more nutrition to heal a broken bone, a crushed skull, or whatever. It just naturally happens. So why wouldn't we apply that to a cosmetic patient, right? It's not like going to the hair salon where you walk in, they do your hair, and you walk out and you look great. No, it's a process and it's a team approach. People ask me, what can I do before surgery, doc? And that's when I shine. And I say, okay, the first thing we're going to go through your history. The first thing you're going to need to do is you're going to need to stop doing this. I want you to stop dieting. I want you to come off all these medications. Okay. And I want you to start hydrating. Number one, you need to hydrate your cells, hydrate your body. When you come into surgery hydrated, we have to give you less fluid. Your kidneys are already working, so the medications we give you are going to clear out of your system faster. And you can tolerate any kind of fluid loss or blood loss or whatever and bounce back faster. The people who smoke, sit out in the sun, do all sorts of activities that desiccate, dry their skin, will have a harder time because we have to catch up in the OR. We have to give you more. So you're going to feel more sluggish afterwards, right? We can go into smoking later because it's an unhealthy thing, but I'll stick with nutrition. As far as nutrition, those of us who don't have a very, let's say, well-designed history, like taking nutritional supplements and eating well, eat the regular diet. They have just enough calories and just enough nutrition to sustain themselves on a daily basis. When you stress your body, you're going to require more of certain minerals, more of certain amino acids, more of certain proteins. So I recommend what you can do to supplement that. In addition to hydration, there are some nutritional supplements, and I'm not talking calories, I'm talking anti-inflammatories, antioxidants, like you said, glutathione, magnesium, copper, zinc, iron. All these things are essential for wound healing. Vitamin A, vitamin C. You need the building blocks to build your incision back together, your scar to heal better and to stay that way. Because if not, you may take longer to heal. Your scars might not look as pretty. Your tissue may fall apart. Remember, after surgery, the only thing holding you together are my sutures. It takes about 6 to 8 weeks for your body to start laying down collagen. And then it takes about 8 to 12 weeks for that collagen to link and become strong. So now your body is what is supporting itself. So if you shift that curve down the road, there's more chance of you having a problem with your incision and wound.
True.
I can tell after doing this for 24 years, like when I used you, when my incision on you, I cut into tissue and the fat is healthy. The skin bleeds well. I can tell it's not under stress. And on the contrary, if I operate on somebody who I know is just not there, I can tell. I've had to take extra measures, put in different types of sutures, keep you with drains longer, put you in binders to help protect my work. So that's why I think it's very important to be on some sort of nutritional substance. I know it's a long answer, but I had to get it out.
No, it's a great answer. And it brings us awareness to, what are we doing for ourselves? A lot of times when we walk into plastics, I think what we're asking for is, can you wave a magic wand? Like you said, can I walk in the hair salon? Can you just make it gorgeous? And then can I walk out? And it's so much more intention than that. It's like I said, to me, it's factory settings. How do you reset me back? Because then I have a job after to stay healthy, stay vibrant, recover, and then also maintain this result that I got. But when it comes to your patients, do you have some stories of people who came in who finally got plastic surgery, but it was like the ultimate game changer? For me, to cure neck pain was a big deal because I won't even take NSAIDs. I'm anti-painkiller. So I was doing every natural thing, and I was still finding in the mornings I'd want to stay in bed longer because I'd be in pain. All evening I would be laying flat, and I had young kids. So by the time I realized this behavior change due to neck pain, I realized I have to address it. But are there others who have needed it, finally gotten it, and then now they're like, oh my God, thank you. My whole life has changed.
Yeah, well, thank God, almost all of them come back. I always ask every after surgery, is it what you expected? Is it worse than what you expect, or is it better? And most everybody's like, wow, I should have had this a long time ago. I just had to get past, the process.
Right.
Early on, when I started doing a lot of breast and body contouring, obviously working in the hospital, one of the nurses who had 2 or 3 children said, listen, I don't even want to wear a bikini. I don't want to take my clothes off in front of my husband. I just feel bad about myself. I wish I had my body when I was whatever. So we ended up performing surgery on her, just did a simple breast augmentation and a tummy tuck. That's a form of a mommy makeover. Immediately, I could see a change. I can see a change after the second or third week on how she felt about herself, how she was getting into healing and so forth. This woman went on to a very aggressive regimen of working out, CrossFit, lifting. She got a personal trainer, got into a competition, a bodybuilding competition with just, cut abs and muscles and won like the Miss Mommy competition.
Wow.
And I still have photos of her before and after, and I'm thinking, wow, what a 360. This woman wouldn't even take her clothes off in front of her husband and now goes on stage with a little teeny bikini and is proud of her body.
Mm.
Plastic surgery is transformational. Everybody thinks it's superficial or it's, oh, it's just cosmetic. But when you talk about changing someone's life, do a breast reduction on a young girl who has, triple G breasts,
Mhm.
and then see her sit in front of you a month after surgery or 2 months. Their clothes are different. Her hair is different. She has a smile on her face. She's now doing things. And the only thing I did was the reduction.
Yeah.
So it's transformative, not only physically, but mentally, and it transitions into other parts of their life.
Sure.
Now they do want to do things to be healthier. They do want to eat better.
Right.
People ask me, I think we had this conversation during a little coffee break at the meeting. Do you want people to diet and lose weight before their surgery? People come to me and say, you know what, I wanna do as much as I can first. I'm like, no, I want you to have surgery, at your base weight, because once you see what you look like, you're gonna work harder to keep it that way.
Right.
If you fight to lose weight and really go on a diet, it's going to be longer and harder for you to heal. But everybody bounces back a little bit after weight loss, right? You hit like a bottom, and we all have a place where we live.
Yeah.
I don't want you to have the surgery and then bounce back. It's a downer. I want you to have it in, quote, your natural state.
True.
We'll get you nutritionally beefed and buffed, but your body, no, we'll take care of that for you.
I love that you brought up confidence because you're right. So many people think of plastic surgery as like, that's so vain. That's so superficial. How lazy must you be that you need to go do that? Why can't you just put in your time at the gym and with food? And I definitely grappled with that because to me, I work hard for my health. I have since high school. I want to prevent diabetes. I have lifted and had trainers through high school, through college, post college. To me, health has always been a little bit of a mountain. It doesn't come naturally. I have to work for it. And so to finally come to that decision, it took me like 10 years to come to that decision.
Yeah.
And once I had it, all of a sudden, confidence does change. And I told you this at the conference. When you're confident, everything else in your life changed. My business changed. How I approached my business changed. Because if you can imagine, I'm only 5 feet tall, but if you're small and you're at like a 32G, you're always going to be hunched over. You're always going to have a weird posture. You're always trying to hide this thing that to you is like a little shameful or just a little bit too much. And so I can just imagine a young girl. I've met many of them where when they have this much larger chest, they can't wear spaghetti straps. They can't dress the way they want. But all of a sudden, confidence shift because all of a sudden you're lighter and it's just easier. And so, do you have any other stories like that of patients? Because I remember when I came to your office, I saw men in there, I saw women. And I thought, oh, I thought only women do this. I forgot men.
I tell everybody it's not a failure when you decide to have plastic surgery. Okay. It's not, oh, I'm giving up. I'm just going to do it. Number one, any type of like I say abdominoplasty or liposuction, it's not a weight loss procedure. It's a body contouring procedure. Okay. The misconception is that you have to be large or heavy or overweight to have a tummy tuck. No, no, you do not. There are some functional issues with the abdomen, just like with the breast, and I'll talk about the breast in a minute, that would prevent you from moving to the next step. For example, very athletic mommy who's 35, 36 years old. She's had her 2 kids. Maybe she had a C-section, so she had a surgery, and she goes to the gym every day. She diets, and she cannot get rid of her mommy belly. She cannot get rid of it. And she's been to every trainer, spent thousands of dollars. And what she has is just an anatomical separation of her muscle from having children. the anatomy that it's called the diastasis recti. The rectus muscle that are supposed to be together in the middle have separated a little bit. And when you do that, the physiology of the abdomen is off, and you can do 1,000 sit-ups a day. It's never going to get better. That's why I jokingly say that's why God invented plastic surgeons, because we know how to repair that.
Right.
And I've had so many women, very thin, low body mass index, who have had abdominoplasties for the physiologic reason that it restores their anatomy so that now they can proceed to work out and feel comfortable with themselves. And we share a trainer together, and my trainer, I had taught him what to look for. And I said, when you get somebody to a certain point, just ask them, do they have a little separation there? And educate them on their anatomy and say, I can only take you a certain point, and then we have to do something else. It's not giving up. Right. It's the same thing with the breasts. Genetics and nature is unfair. Some very thin, skinny women have very large breasts. Right. And it's to restore body proportions. It's not because I just want to look better or I want to fit better in bikini. It is disproportional. Right. And all I'm doing is restoring proportions.
Can we talk for a second about abs being separated? Because there are ads on Facebook targeted towards me that'll say, we can bring that back together for you. So are you saying that through training, if our abs have truly created that space, because I gained 45 pounds with Anya, like I gained weight with my pregnancies, even though I was working out and doing the good things. Once that separation happens, is it impossible for us to get it ourselves?
It's not impossible. I would say it's a very low percentage. It is unlikely.
Okay.
So a natural childbirth, that means without a C-section, if you spontaneously deliver, there's no anatomical destruction of the muscle, okay? But during your pregnancy, you think, how can I go from a little skinny woman to having a baby in me that's this big? Well, over time, your body releases hormones and relaxins. So your body naturally changes and it becomes more pliable, right? So you can hold a 8-9 pound baby in your belly. And then afterwards, the hormones change again and it reverses and it helps it come back together again. Well, do that 2 or 3 times, right? If you take a rubber band and stretch it enough, it's not going to want to come back together again. Right. So if a natural child is born, that separation can come back together again. And in the olden days, and I think we talked about this, that's why corsets were developed. Right. I mean, back in the 17th century, they knew something that we don't know now. Corset, bind the woman. So you're physically trying to bind the abdomen together to hold it. Now, certain women, yes, it may come back and heal and be fine. Others, it will not. If you have a C-section, the surgeon makes an incision to go in and get the baby, but sometimes the separation of the muscle, he has to create it to get the baby out. That's never repaired. It takes too long and it's hard to do from that incision. So now you have a physical separation. So in that case, it's harder for your muscles to come back together.
Wow.
It's a really easy test for women to do. You lay on your back, and what you try to do is a sit-up. And you bring your legs and your head up at the same time and just feel where your belly button is. If you feel a little finger separation, that's your muscles separated. It's called a diastasis recti.
Interesting.
Right? It can be a genetic problem that people are born with, but most likely it comes from having babies. And that's why the abdominoplasty or the tummy tuck was created, because it fixed that problem. Muscle first, then all the skin and stretch marks and everything after.
Right.
But it's not a weight loss procedure. It's a functional procedure.
Have you found, this current culture we're living in is one of work for it, sweat, exercise, CrossFit, diet. Like, I feel like women are torturing themselves all day.
Right.
And when it comes to that excess skin on the body that you just spoke about, do you think the body is able to always reabsorb it?
That's really a great question, because about 5 years ago, when I came into practice, gastric bypass and all this bariatric surgery was really in vogue, and people were losing weight rapidly.
Right.
So just like the mom who goes from flat, skinny woman to having their stomach stretched that much in 9 months and has the reverse happen in 9 months.
Right.
Somebody who's heavy has their skin stretched their whole life, right? So
Yeah.
if you lose skin rapidly, it's not able to keep up, and you end up with stretch marks and loose skin.
Right.
Some of it will retract, but not all of it. Okay. You can lose weight, so the fatty layer of your skin goes down, but the actual skin is there in volume. You're never going to get exercise is never going to get rid of skin. That's a fallacy. Okay.
Yeah.
And people think, well, I'll just bulk up my muscles and I'll
Yeah.
fill it up. Another fallacy. If you've got extra skin, you need to treat the extra skin.
Got it.
Okay.
It's so interesting. You know what I'm thinking about? I'm thinking about the fact that, like, I don't know, we have what, 350 million women in America, and every country handles things differently. I find when you go to Europe, they have a different approach to pregnancy. And
Mhm.
here, oftentimes, women gain so much weight. But I wonder how many women are killing themselves for decades after having kids with the excess skin, with the abs separated, just trying so hard to achieve the goal, but not achieving it. So my friends always think I'm crazy when I talk about plastic surgery. They're like, Shivani, you're in health and wellness. Like, how could you even have a conversation about that? And I'm like, guys, every tool matters. I've had fibroid surgery. If I needed, and I might one day need bunion surgery the way I'm going for my feet, because of my feet problems, but I'm trying to avoid that one. But the fact that I made this conscious decision and came to you, I wanted to share because I'm sick of women suffering. I'm sick of women feeling
Mhm.
like I'm trying so hard, but I'm still not winning. The problem must be me. When in fact, we are doing our best. But big life events, pregnancy is one of them, but those big life events can create these huge shifts in the body. And then all of a sudden, like I've met women lately who do IVF. And when they do IVF and go through that journey, sometimes that hormonal shift is so
Huge. Yeah.
tremendous and they have this huge weight gain. So, what if they are trying everything, but that excess skin is not something they can win at?
It's actually it's amazing having treated women for 25 years. I treat men as well, but it's basically every day women, women, women. It's amazing what you as a whole go through just for children,
I know.
just to have children. And it's almost like you don't care about yourself. It's all for the child, which is amazing. And that's what makes you special as a gender.
Yeah.
And it's hard for me sometimes to see women who don't want to have anything done or are afraid of it when I know you can, like you say, go back to your factory settings again. I tell everybody, I'm not going to change your entire body. I'm just going to make you the way you were before you had all your kids, right?
Right.
I always have, did you like the way, oh my God, my body was great. I worked out and then I had all these kids. Of course, it's hormones and it's time and it's stress and it's everything else. And now all the kids are grown and you're 38 years old. You have your entire life to live. Why not take care of yourself in one operation? In
Right.
one operation, I could basically reset you. Now you can work out, you can wear the clothes you want, whatever. You're going to have some scars. And most women are afraid of scars. Really, you will see through the scar. I don't care if we have scars all over. When you look in the mirror and you say, oh my, do I look fantastic? You see right through the scar,
Right.
right? It may be a secondary, yeah, they're a little funny, but the overall picture is what women look at.
Right.
So part of my consultation is I try to de- debunk, demystify anything that you may think of. I try to shoot it down
Right.
so that you understand. And I think it's a defense mechanism, right? People say, well, I don't want to do, I don't like pain. Oh, I don't, whatever. I say,
Yeah.
well, I do this, I do that, I do this, I do that to prevent it from happening.
Right. And then another question I have, in your office, you have always supported massage afterwards, lymphatic massage, reduction of inflammation. You talk about nutrition beforehand and how you show up to surgery. To me, that made you so distinct because, again, anything I do, I've interviewed a lot of people before I make the big decisions for my body. And so, will you speak into the importance of that post op recovery and why you are such a proponent of massage and using tools to help heal after?
Because just like we prepare and run for the marathon,
Yeah.
it's not over the day after surgery. I have to now get you back to normal activity like you were before. And I always like to lay out the 1 month where you're going to be at 2 months, where you're going to be at 3 months, all about reasonable expectations. Now, some people are ready to go and they feel great in a month. Some people it takes a little longer because it's the baggage they bring to the surgery and how well they pay attention to us afterwards, right?
Hmm.
One thing that I can offer that the patient can't do themselves is management of their tissue, fluid, scar in the post-operative period. Everybody who's had either belly surgery or breast surgery, obviously you get puffy, right?
Yeah.
Your body responds to a trauma, whether it's surgical trauma, even though it's controlled surgery, it's a trauma to your body. Your body doesn't know the difference between getting hit by a car or having surgery. All it knows, it was hurt.
Right.
So what is the early phase of healing? Naturally, inflammation.
Right.
Right. So if you come into surgery not prepared to handle inflammation, it's going to be longer for that inflammatory response to leave. So we'll talk about getting you prepared, but afterwards, I want to decrease the inflammation, decrease the edema and swelling. Edema and fluid collection is the enemy of healing.
Right.
And it slows healing. So lymphatic massage has been shown and documented to promote increase in circulation by decreasing the amount of fluid, third space fluid, we call it. It's not in your veins, it's not in your arteries, it's just hanging out in tissue.
Right.
Like when you injure your ankle and you twist it, it gets all puffy. Why? It's fluid. What do? We wrap it to squeeze the fluid out. Well, we can't wrap your whole body. So what do? We massage the skin. We use ultrasound, open up the lymphatics. So your body now starts removing it itself.
Nice.
And I will tell you, people come in the very first day after surgery and are sore, and that's very expected. When we can touch you and you don't hurt, I send you over to Chrissy in my office, and we start ultrasound and massage. Very low speed ultrasound. It kind of opens up the lymphatics, and then she does hand massage in your skin. People walk out where they may have come in all crumpled up. And they're like, and this is my next appointment. And we also massage the scar because scars are dynamic. All they know is they want to heal and get tight. But if we relax them and we massage them and put oils on them, they heal softer. They heal better than before. So nobody's going to do that at home. They're going to not want to hurt themselves.
Yeah.
So what we provide in the office is that 1 to 2 months after surgery, we get you back as fast as we can. And
I love
to
that.
me, that's one of the best things I started in my practice about 5 or 6 years ago. And it has set me apart because no one in the area provides it.
No, I haven't seen it anywhere actually. And it, as someone who reveres the lymphatic system and its ability to heal us, I appreciated that you had someone who you trust in the office. And what was cool was if anything was going sideways, you'd say, you know what, I'm going to call Dr. D in here to look at this.
I'm right there.
You're right there. So you could kind of say, that looks fine. Actually, let's adjust this thing there. What are you doing at home? Can you speak to curcumin? Because I know you're a fan of turmeric and my turmeric and what I've created and its role in healing and wound healing and things like that.
Absolutely. I'll speak from a personal standpoint and I'll show how it relates to my patients as well. Obviously, I was introduced to the use of curcumin by you. I have heard about it. My research when I was a resident was in oxidant stress, inflammatory stress, and I dealt with glutathione. I was the glutathione king, published on it. Glutathione is a natural anti-inflammatory in the body, powerful. And I knew that inflammation played a role in healing and in patient health. So I've always been kind of a fan, but as a surgeon, I was busy doing other things, right? I had a serious orthopedic injury and I had trauma and I suffered from chronic pain and inflammation despite doing everything that I thought that I was doing. Also suffered from some benign prostatic problems. And again, prostate inflammation. I was taking all the medicines for that, didn't work. I started personally taking the curcumin, um, two different types, right? There's an anti, it was
Turmeric
the,
gold and inflammation relief.
there you go. I take both. I noticed that my reliance on other nonsteroidals and anti-inflammatories had gone down. Motion, pain, and inflammation in my knee went down. It's still there, but went down. But the biggest surprise to me is, improvement with my prostatic problems. It was a secondary, and I didn't even realize the cause and effect until I went away on vacation and I didn't have anything available and I stopped taking it. And I'm trying to think, what is going wrong? Oh, I forgot. I've been off of, my supplements for like 10 days. So now wherever I travel, I carry extra bags of bottles. I thought that this would be beneficial for my patients. So I start offering each one of my exam rooms. I have information about it, and you will be surprised. And when I walk in for my consult, the patient already has the information on their lap and they've already been reading it and look at it. I think people are hungry for the things that can help them. They want help. And this product, this curcumin, is amazing. I supplement all my patients with it prior to surgery. I like them to start it before a few weeks. Then I have to stop it because it causes a little bit of, it works too well because it thins your blood. We don't want you to bleed, but they start on it post-operatively again. And I will tell you, you start the regimen, require less narcotics, less nonsteroidals, will feel better. And when you mix that all in with the anti-inflammatory massage, it's like a win-win.
Nice.
And not only in my my aesthetic patients, I've also found it in my reconstructive patients who underwent trauma surgery.
Wow.
I'm a fan.
Thank you. I love hearing that. That always makes my day. So when it comes to trauma patients, and this will be my last question of the day,
Sure.
when it comes to trauma patients, I know you work with other surgeons and people in the area. What is the role of plastics and aesthetics in that? And I actually have an example. My son, when he was little, fell and he hit the fireplace just right. And it cut him here. And he's going to have that scar forever. And I remember my family members, when we were running for the hospital with this bleeding child, said, we better call aesthetics. And I thought, doesn't every doctor know how to sew up something? Like, what are we talking about? They're like, no. You're going to prefer that aesthetics does something if it's here. And it turns out no one was available. So whoever did it. They did a great job. But will you kind of explain that role? Because most people don't think about it. They think of plastics as just aesthetic, when plastics is actually so much more. It's true healing across surgical specialties.
Our training and our degree is plastic and reconstructive surgery. It's actually two specialties in one. We're just either fortunately or unfortunately known for just the cosmetic stuff we do, right? The lips and the things and the tummy tucks, and that's all you see on the internet. But we act as the resource in the hospital for all other specialties. When an ER physician, emergency room physician needs help, they call us. When a cardiothoracic surgeon has it, they call us. When orthopedic surgeons have a problem, they do great jobs reconstructing joints, but if they have a problem closing the wound, they call us. Why? Because we, by tradition, we're trained in other specialties. I'm a fully trained general surgeon first. Now I move on and we learn the finer points of wounds and closure and healing. So when you call a plastic surgeon, you are going to get a little bit more attention to detail, attention to reconstructing. We call it form and function. Okay. If there are 3 or 4 layers to the skin, we close all 3 or 4 layers. We line it up. We got the right sutures, the tension. It's just a little more attention to detail. Where emergency room doctor, he has a laceration. He's going to sew it up quickly. He's going to get you out. He's going to make sure you're fine. That attention to detail is not there. Okay. Right. And usually in areas of the face, eyes, nose, ears, complex tissue losses, crush injuries, hands, you'll you'll probably see a plastic surgeon involved because that's where our expertise is.
That's so interesting. I love learning new things. Thank you for sharing that. Perfect. So, Dr. D, before we wrap up, will you share where people can find you?
Sure. My office is Boca Raton. I'm in Northwest 13th Street, Suite 1C. I moved. We just have a new office.
Yeah.
My phone number is 561-361-0065. If you want to get a little bit of background on me and some of the work I do, I have a great Instagram page. It's educational. I show before and after pictures. I show a lot of my trauma. And that's at Dr. D Boca, DRD Boca. And I encourage you to go and check it out.
Perfect. And what's your website?
My website is dranthonydardano.com.
Awesome. Easy. So I hope this episode was educational for everyone. I know it's off the beaten path from my normal topics, but I am very passionate about East, West, and the two meeting in the middle. And Dr. D, you are one of those very few who I've met who's beautiful at meeting right in the middle. Nutrition, training for a marathon, really honoring the body and what the body needs to be back to its factory settings and its healthiest so we can move forward and build the health and the life and the vibrant health that we want. So thank you so much for joining me on the podcast today.
Well, thank you. You're inspirational. I love your passion for what you do. And I love the fact that you're reaching out and just showing other people things that they don't know and never thought to look at. It's really refreshing. And it's my pleasure and honor to know you and to participate today.
Thank you. Thanks for coming. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health podcast this week. You have the power to transform your health and achieve vibrant health starting today.